So the two cases I'm going to talk about today are Baby Doe and Baby Jane Doe. I'm going to start with the Baby Doe case and then move on to Baby Jane Doe. So Baby Doe was a child that was born in Indiana with Down syndrome and a tracheoesophageal fistula. At this birth, the obstetrician talked with the parents and said that they didn't believe that surgery was a viable option because the chance of would be about a 50-50 chance, and that the prognosis after would not be great. So the parents decided to refrain from having the surgery due to the complications. But two other doctors got wind of the case or were put on the case, and they disagreed with the original assessment by the obstetrician, and they revisited the family, informed them that they believed that surgery was a viable option, but again, the parents refused the surgery. So this case was taken to court, and in the lower court, the parents' decision was upheld. But it was taken then to the Supreme Court. But unfortunately, the child died of dehydration and pneumonia before the case could be heard by the Supreme Court. And these were two complications that came about because they did not fix this fistula. So after this case, the Surgeon General at the time was very distraught by the results of this situation because he had performed this surgery many times and had had a very high success rate. So he started to advocate for the rights of disabled infants with their medical care. So this brings us to the Baby Jane Doe case, and she was a child that was born a year later in Long Island, New Jersey. Also, this was in the 1980s. She was born in Long Island with spina bifida, hydrocephaly, and microcephaly. And so at her birth, the doctor said that they'd like to perform a surgery to fix the myomeningocele as well as decrease the intracranial pressure. But even with success with the surgery, there would be a lot of complications. She would most likely be bedridden, she would be paralyzed, she'd most likely suffer from epilepsy, and there was a high risk of future infections, which would lead to a lot of further hospitalizations. So the parents decided to refuse the surgery and move forward with a more conservative treatment regimen of hydration, nutrition, antibiotics, and bandages and braces. But one of the results of the Baby Doe case were tip lines that were set up for people to call in when they believed that the rights of infants were being violated. And so a tip was called into a local lawyer, and the lawyer decided to take the family to court to advocate for the patient to have surgery. Eventually, this court decided to uphold the parents' decision, and then this court case began to bounce between multiple different courts, and essentially it resulted in the 1984 Federal Child Abuse Amendment. So this amendment came about due to these two cases, and it says that all children or all infants are required to receive nutritional, hydration, and other medical services, regardless of their status. There are a few exceptions to this, though. If an infant is in a coma, if they have a terminal illness, and if it would be inhumane to provide further treatment, they would not be required to receive these treatments. But all other infants are required, or physicians are required to provide these services. Some of the articles that we looked at argued that this new law ignores quality of life and the parental right to make decisions for their children or on the behalf of their children. So that is one of the main one of the main issues in these two cases are when making decisions for a child, who has their best interest in mind, and when does the law or do medical professionals, and then above that, the law have a right to step in and override parental authority. And then another issue would be the use of medical technology to either prolong death or to provide treatment, even if it creates greater complications on the other side of the treatment. So those are the two ethical issues, or two of the ethical issues. There are many. And then two of the bioethical principles, the first one being autonomy. In both of these cases, multiple courts found the parents' right to make decisions for their children to be ethical, and upheld these decisions, or upheld their decisions. But some people would argue that the parents did not have their child's best interest in mind, especially with the child's disability, or when considering the child's disability. And then the other bioethical principle I found was non-maleficence. So specifically in the Baby Doe case, the parents decided to forego this treatment because of the complications and the prognosis given by the obstetrician, but they did not reevaluate once the other set of doctors gave their recommendation, and they didn't change their mind. And ultimately, it led to the death of their child due to complications from an untreated condition. And so this federal child abuse amendment has been used, or has been cited for a lot of different cases throughout the years, but specifically in neonatal care, I found a study that showed that neonaticians or pediatric doctors are more likely to resuscitate neonates when they're in the hospital, because it's easier to determine a course of treatment from there if they do resuscitate, even if it goes against the parental the wishes of the parents. And so this act, to comply with this act, doctors have adjusted their treatment, but prior to this act, asking to refrain from resuscitation wouldn't have been contested, and would have been respected by physicians, and as well as maybe not, but physicians specifically. So that's the way that this act has, or one of the ways that this act has contributed to medical decisions today. And I will post my discussion questions below.